Good evening, everyone. How are you doing this evening? Thanks for coming out in this cold weather. I know it's really cold out there, so thanks for braving the weather. Uh, have any of you ever wondered why my feet hurt so much? And it started to hurt and I can't do anything about it. What do I do? Well, today we're going to talk about foot problems and ankle problems. What do we do? How do we correct them? And I'm Dr. Horowitz again, and
I'm Devanshi Modi. I am the owner of Spineck Physical Therapy. A very warm welcome to you all, and hello to all the Zoom people.
hi.
And yes, so today we are going to talk about foot and ankle pain. Dr. Horowitz will touch upon the medical aspects of it, and I'll be covering the movement and the physical therapy aspect of pain and foot and ankle pain. Over to you, doctor.
Okay. Let's see. Okay, so here we're looking at a model of the foot. The foot has 26 bones, 33 joints, and 100 ligaments, tendons, and muscles. That's quite a bit, actually. We're not going to go over every single one. That could take up to 4 years to learn all of it, every nook and cranny, basically, of it. So we're going to just touch bases on the foot, the ankle, and what we can do to help with it. So here we're looking at, let's see, that bone over here, that's the big bone of our foot. That's called the calcaneus, the heel bone. The bone over here, that's called the talus, that rests on the calcaneus. And these two big bones basically up here, you have your fibula and you have your tibia bone over there, which form the ankle joint. That area forms the ankle joint. Foot anatomy, we have the hindfoot, we have the midfoot, and we have the forefoot. That's how we break down the foot. It helps subdivide the foot. So when we're explaining things, sometimes we say the calcaneus, we know it's the hindfoot. We say the metatarsals, we know it's the forefoot. So it's a way of breaking everything down. Why do we get foot and ankle pain? How do we treat it? And how do we prevent it? Foot and ankle pain comes from many different things, many different diagnoses. How many of you in the audience have foot and ankle pain? Okay, quite a bit, quite a bit. So you could all relate a little bit. That's good, that's good. So one of the problems actually that can cause foot and ankle pain is plantar fasciitis. How many of you get up in the morning and say, ouch, my foot hurts so much. I can't put my foot down. It's hurting so much. What do I do? Sometimes, yeah. That can be due to what we call plantar fasciitis. Now, what is plantar fasciitis? Plantar fasciitis, if we break down the term, we were always taught to break it down to simplify it, to understand what plantar fasciitis is. So plantar meaning the bottom of the foot, itis meaning inflammation, and fascia meaning the tip. Oh, yikes, what happened there? Itis meaning inflammation, basically, and fascia, the tissue on the bottom of the foot. Hold on one second. Oh, there we go. Okay. Very good. So we could see here that over there is basically called the plantar fascia. It extends basically from the heel bone over there all the way to the ball of the foot. The plantar fascia has 3 bands on it. It has a medial band, which is the inside, basically, the inner arch. It has an outer arch band, and it has a middle band, which we call a central band. Okay, so here we have the heel bone over here, the calcaneus, as I mentioned. And here, what we have here, this little fluffy thing over here is called a heel spur. A heel spur is bone growth. We could have multiple spurs on the feet, and they occur in different areas. Most of the time, spur formation comes from arthritis, which we'll go on a little bit. We'll talk about that a little bit after. So here we have the plantar heel spur on the bottom of the foot. Up here, sometimes we have a posterior heel spur going on the heel bone right over there, the posterior heel spur, attaches basically to the tendon in the back of the foot, which we'll talk about a little bit later as well. The arches of your foot. We have 3 arches in our foot. Did anyone ever know 3 arches? Most people think that we have 1 arch in the foot, but we really have 3 arches. We have the medial arch, which is the most common one, which most people know that we have. We have the lateral longitudinal arch, and we have the transverse arch. The transverse arch basically is this over here. The lateral is the outside of the foot, and the medial longitudinal arch is the inside of the foot. This here is the medial arch over here, and the lateral arch over there as well, and the transverse arch. Foot arch types. We had 3 types of foot arches. One of them is a normal foot, and we were taught that we never really have a normal foot. No one has a normal foot. We always have some type of problem with the foot. It may not affect us, we may not feel it, but we could always find something wrong with the foot. So there's no thing as a normal foot, but for illustrative purposes, we have here normal foot. We have a high arch foot over here. You can see the arch is high over there. And when you have a high arch foot, that's known as a cavus foot, high arch. And then we have a flattened arch over here, which most people are more aware of the flattened arch, which is called pes planus, actually, which is basically Latin for flat feet. How many of you in the audience have flat feet? Okay. So flat feet, basically, we call flat feet the root of all evil. It causes all problems with our foot. Our foot bones become very hypermobile, and when they're moving around a lot, we tend to have more problems with the foot. Okay, so here we have basically, this is our severely flattened arches over here. This is our cavus foot over here, high arch foot. And here we could see how the arches are collapsing over there, and we could see how the arches are higher over there as well. High arch foot basically tends to affect the muscles and the tendons on the outside of the foot. A low arch foot or a flat foot tends to affect all the muscles and tendons on the inside of the foot. The tendon and the muscle that holds up the inner arch of the foot is known as, we call it the posterior tibial tendon. And that's the master of holding up the arch. It's a very strong tendon. It holds up the arch, but the problem is when the muscles get weak, the tendon gets weak, it causes that arch to collapse, and that's what causes a flat foot. And flat feet can become very painful. We're going to touch a little bit on ankle sprains and strains, which is very prevalent during these winter months, where it's very cold and it's snowy. We step outside, we try to shovel or something like that. Our foot goes inwards, and what do we get? We get what we call an inversion ankle sprain. When we get an ankle sprain, we're really concerned about the ligaments in the ankle. We're also concerned about the bones. Sometimes with an ankle sprain, you tend to take a piece of bone with it. It's called avulsion, and that takes a longer time to heal. And we would need to take x-rays to make sure that there's no fracture or avulsion due to the ankle sprain strain. Once we get an ankle sprain, we're more prone to getting other ankle sprains because it weakens our tendons and muscles in the foot. So it's very important to strengthen them, which Devanshi will talk about afterwards, how we could do that to help regarding that. Okay. Arthritis. As I had mentioned, we'll touch on that. Arthritis, we could break down the term arthro, which means joint, and itis, which means inflammation. Inflammation of a joint. Joints are all over the body, all over the foot, actually. Oh, let me go back here. So this could be a joint over here. This would be called your talocalcaneal joint over there. And this here is a joint over here that would be called your metatarsal phalangeal joint. A joint basically connects bone with bone. That's the definition of a joint. It's connecting with bone, separated by cartilage. We do not want bone rubbing on bone because that causes arthritis. We want the perfect amount of cartilage in between the bone that helps to cushion it, so we do not get that arthritic pain. That can be very painful. Arthritis, there are multiple treatments for arthritis, but one should know that there's no cure for arthritis. It's a systemic diagnosis. Sometimes we supportively treat it. We put them on steroids. Sometimes we give them cortisone injections. That helps, but there is no treatment. There's no cure for arthritis. Here's an X-ray of ankle arthritis, and if we could see, where this joint is over here, we could see basically you don't even see the bone joint over there. That's how destroyed that joint is over there. This must be extremely painful in the patient. This here, we could kind of see the joint over here, but over here, you don't see any joint. You just see sclerosis, what we call sclerosis, that whitish discoloration. That's from the X-ray, where the X-ray was taken. Arthritis is not fun. Sometimes we refer patients over to a rheumatologist when the arthritis is really bad. There's multiple types of arthritis. The arthritis doesn't only affect the joints, it affects other parts of the body as well also. Now we'll touch on Achilles tendinitis a little bit. Achilles tendinitis, once again, tendinitis, inflammation of the Achilles tendon, which is this tendon right over here. So that's a very strong tendon. It's a very strong tendon which has a very weak blood supply over there. But the reason why I mention it's very important to mention as a very weak blood supply is because if you strain that tendon or you rupture that tendon, if you rupture the tendon, it probably won't heal without surgical intervention because the blood supply to the area is very limited, which makes it harder to heal. The number one thing and the most important thing for anything to heal is a good blood supply. And when we don't have a good blood supply, it won't heal properly. So the Achilles tendon basically is connected to the calf muscles, your gastrocs over there, and it attaches to the heel, the back of the heel over there. Sometimes we could get a spur in the back of the heel over there. That's otherwise known as a Haglund's deformity. So this Haglund's deformity basically rubs against the tendon over here, and it could cause Achilles tendinitis. Sometimes the two go hand in hand. Achilles tendinitis, Haglund's deformity. Haglund's deformity is the arthritic version of Achilles tendinitis, basically. Okay, medical management medications. For any type of foot pain, especially if it's due to inflammation, what we would like to do is bring down the inflammation. How can we bring down the inflammation? That's the next question. There are NSAIDs. NSAID is a non-steroidal anti-inflammatory, which helps a lot with bringing down inflammation. The problem with NSAIDs, you need to be really careful, especially if anyone has heart conditions, number one. Secondly, if they have stomach issues, number two. A lot of times we recommend taking probiotics. They do help, especially with taking NSAIDs or any antibiotics. Another treatment is cortisone injections. Like I said, we give 3 cortisone injections, like 2 weeks apart. Each one is additive over the next one. They do help. Sometimes they get rid of the pain, sometimes they don't actually. But they do help quite a bit. Cortisone injections, immobilization and bracing also especially for plantar fasciitis. We do splinting, basically. We call it a low-dye tape strapping, which helps to build up the medial longitudinal arch, which we were talking about, and that does help quite a bit as well. Okay, so NSAIDs, what we were talking about, Tylenol helps also. There we go. Cortisone injections are appropriate, basically, as long as the patient doesn't have any issues, sensitivity to lidocaine or anything like that, or sensitivity to steroids, or if they're diabetic, they have to be really careful because sometimes the steroids could elevate the blood glucose, the blood sugar. So we need to be really careful with that. Sometimes we consult with their primary doctor, or we ask the patient how well their diabetes is under control. If it's not going to be under control, we'll probably stay away from injections. Location matters, heel versus tendon. Heel, we typically more prone to giving cortisone injections as long as it'll work for the patient. Tendons, we want to be really careful because if we inject a cortisone into a tendon, what can happen is it can cause tendon ruptures. So we want to be really careful with that. Okay. Another treatment, extracorporeal shockwave therapy. That works really well. It is a form of like a lithotripsy. It breaks down, like they use it to break down kidney stones. And this breaks down the plantar fascia. So we're kind of injuring the plantar fascia to help reheal it. The key with extracorporeal shockwave therapy is to bring blood supply back to the heel so it has enough blood supply to help heal it. That's the key with ESWT. Now, ESWT works really well. We have like a 99% success rate with ESWT, so we tend to use that, and it works really well. So it works basically at the attachment, we call that the insertion point, basically, where the tendon attaches basically to the heel itself. Yes. When you have what we call plantar fasciitis, kind of like in the ball of the foot, which I didn't mention, if you have it kind of like in the middle of the heel, in the middle of the arch, a lot of times that could be associated with a recalcitrant plantar fibroma. A plantar fibroma basically is a nodule that forms in the middle of your foot, and those are self-remitting. So they come and they go. We treat it if it's very painful. That's when we would treat it, basically. So treatment only if it's very painful. We treat the symptoms. We put a little cortisone in, and it helps shrink that plantar fibroma. So a lot of times we have a patient come, hey, I have the problem in the middle of my arch, actually, not at the heel. So then we feel for fibromas. Sometimes we feel them, sometimes we don't. If we don't feel it, the chances are it remitted on its own, basically, so it will get better. But that's what we typically see when we have that. Okay. Immobilization and bracing, especially for ankle sprains and strains. We use an ankle brace. They sell them at all pharmacies. Something that helps support the ankle and the arch, the medial longitudinal arch, the ankle. It helps stabilize the ankle, so you're not having that pain from the ankle sprain and strain, actually. Ankle braces, activity restriction, RICE. Anyone knows what RICE is? Rest, ice, compression, and elevation, yeah. It tastes good and it works good.
Not biryani.
Okay. There we go. Okay, and that's, Okay, now I am gonna hand over the mic to Devanshi, and she's gonna talk about a little bit more. Here we go.
Thank you so much, doctor. That was very informative on what are the common causes of pain in ankle and heel, what are the symptoms, and what are the medical management in terms of what medications and imaging. Now, what we need to know is that what are the mechanical causes of ankle and foot pain? Our body is related. Your ankle is connected to your knee, is connected to your hip, and it's connected to your back. So it's me, one Devanshi, and not just my ankles, Devanshi. So it's all connected. Anything going wrong down here will make a difference up here, and anything up here can make a difference down there. So what we need to see is why is the pain happening? We'll get rid of it. We'll get the inflammation out. But the most important part is what caused this pain. So there are three main reasons. It could be either tight muscles, it could be weak muscles, or it could be changed way of walking. It's very simple. Something that connects to the back of the calf or the calf muscle. If that's tight, it is going to directly attach to the ankle and heel and pull it in a different direction, causing pain. Imagine walking with a flat feet all the time. You're going to be probably duck walking and eventually hurt your knee or hurt the bottom and cause much more inflammation. So the idea is to fix that along with doing your medical relief of pains and aches. So we're going to discuss in depth how exactly that could be done. So tight calves, weak foot muscles, and altered way of walking. As I told you, body is interrelated. Arches, flattened arches can also cause back pain, or any tightness in the hip can change the way you're walking and can cause outside of the foot pain or inside of the foot pain. But the pain is happening much more higher up in the hip. The tightness is at the hip, or the weakness is at the foot muscle. So it is the physical therapist who finds out where you are not moving right, and we can work that together. Now, along with medications, that was the Tylenol, the cortisone, what is something that we can do ourselves? What are the non-medical ways of helping your pain? Something as simple as ice. It sounds like ice it, like really? But if I give you fancy words for the same thing called cryotherapy, it's going to be like, oh, wow, that's something new. But the idea is, what you do is, the best thing I found for foot pain, take a bottle of water, put it in the deep freezer. It's going to turn into a block of ice. And then you roll the arch of the foot on it. And that's going to help with pain relief, and the pressure will help with the massaging. You do it for roughly 7 to 8 minutes, 2-3 times a day. Get started with it. So if you have any foot and ankle pain, first thing, try icing it. See if that helps it. And not just once, do it diligently, 2 times, 3 times a day. Give it that effect and see if it works for you or not. Second thing that we can try is something called as the contrast bath. So this thing that we see here, I can't find the pointer, but yeah, the contrast bath. You take 2 tubs of water, one with hot water, not burning hot, but tolerable hot, and one with ice cold water. You start with hot, you end with hot. So you do 2 minutes of hot, 1 minute of ice, 2 minutes of hot, 1 minute of ice. Alternate it. What happens is, with the heat, the arteries dilate. With the ice, it constricts. So it's a pumping effect that happens, and that brings increased blood supply to the bottom of the foot or the fascia or the tendon and will help with pain relief. So we spoke about icing, we spoke about cryotherapy. What else can we do? Self-massage. Try working with a lacrosse ball or a tennis ball. A softer ball will not work. Use a harder ball. If the plantar fascia or the bottom of the foot is hurting, try rolling on it front and back. The most important thing, also roll your calf muscle, because that's the culprit. So you roll on the bottom of the calf as you're sitting, long sitting, and you roll on the front sitting, and that will help the pain. Try the vibrator or the massager at the bottom of the foot. Sometimes that helps the pain. So self-massage is another one. If that does not help, then we have something in physical therapy which helps us aid our recovery, and that's the ultrasound. What is ultrasound? The ultrasound is the same ultrasound to see the babies, except there are no babies in the ankles and the foot. What it does, it has a deeper penetration. And when it penetrates deep inside, it helps in increasing blood supply and helps relieving the pain. Another important thing that we have is something called as the TENS, or the electrical stimulation. That also helps in temporary relief of pain by helping with the blood supply and the circulation. So all this is temporary pain relief, like the steroid or like the NSAIDs. But what is most important for us is to correct what's causing these complaints. So shoes, like whatever, do we correlate with these kind of shoes? We like wearing heels, we like wearing flats, we like wearing flip-flops, but are they really good for you? To answer that question, I have a very common saying that picking your shoes is like picking your spouse or your partner. Whatever looks good, are they always supportive? I have an exception though, because he's sitting in the audience. Whatever looks good, are they really comfort? So you have to pick. Most of the times you have to pick whether you want to look nice or you want more support or more comfort. So let me talk about the shoe anatomy. This is how a normal shoe looks like. How do you pick your shoe? When you go shoe picking, always go later in the afternoon. It's a good time to go buy shoes, because if you go first thing in the morning, your feet are not swollen. But as you stand and walk, your feet are going to tend to swell up, and that will eventually, you have to account for those. Wear your regular socks that you're going to wear on a regular basis. And whenever you buy, you have to make sure that the top, the longest finger and the top of the shoe have 1 finger distance. That should be a good size to and the fit. So if you have wider feet, a wide shoe is recommended for you. If you wear one of the stiletto kind of shoes, it's very easy for us to get bunions and problems like that. So we need to make sure that, yep, as we mentioned, 1 finger space between the tallest of your thumb or fingers and the shoe. Now, to answer your question, correct the cause of the problem. If you have flat feet, you need corrective insoles. If the fascia is inflamed, you need silicone kind of inserts to give you more comfort. So whatever is the cause, you try to fix it. Sometimes if your foot alignment is on a very different basis, you need custom orthotics to make sure they fit right for you. But for most times, Dr. Horowitz would be the right person to get custom orthotics, but for the most part, you could have something from a pharmacy, local pharmacy, a medial longitudinal arch or a lateral longitudinal arch. That was all about pain relief, how to get better symptoms. But most important is to treat the cause. And a movement expert helps you to find out what is causing the problem. Is it my shoe? Is it my tight calf? Is it my tight hip? Is it my weak muscles of the piriformis? Or just the habit? Like sometimes I just have a habit of standing with one pressure more on the right feet as I'm standing and talking, causing much more pressure on one side. Or it could be your body weight. So all of this together, we need to treat the cause to get the pain better and to make sure it doesn't come back. So in physical therapy, what we do is a functional squat test and a running analysis on a treadmill that helps us gauge and find out what is going wrong as we are working together or as we are walking, as we are running, to find out the problem. Weight management, heavier we are, more weight on the arches of the foot, more collapse, more pain with arthritis. So controlling our weight is important. So today I'm going to demonstrate simple exercises that we could do at home to get relief of pain. Again, this is not a medical advice, but it would be recommended for most aches and pains. I would encourage you all to do it with me so that we can do it together. So the first one, I am going to borrow a chair. We're going to sit down. For people in Zoom, I have a little video for you guys. Yeah. So it's called the calf stretch in sitting. So let's have you sit down, making sure that the back is resting all the way to the back. Now pull your knee up and now take your ankle all the way up to you. As you do that, you'll feel a great pull in your bottom of the calf. We hold it for a count of 10. Let's do it together. We're going to count. I'll count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and down. It totally depends. You can get you started, but I wanted to do 6, 7. All right, let's do the other side. And you feel the stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I see some wincing faces in the audience already as you feel the stretch. It's a great way to stretch your calf without doing much. If you want an increased way to stretch the same muscle, we have the standing calf stretch. That is a lunge stretch you could do. The runners do it mostly. It's a great stretch for all of us. Or it could be very simple as standing on 2 books and just raising your heels a little bit up. That helps in stretching the back of the muscle right here. And again, you hold it when you're starting off doing that stretch, you want to hold it for a slower count, like 5, 10, and then gradually increase up to 30 counts. A set of 2 or 3 is good. Doing 2 to 3 times a day is perfect. The next exercise I want to do is something called as the toe yoga. It would be great if everybody tries it with me. So what we do is, as you bring your big toe down and lift 4 fingers up. And then next is bring the 4 fingers down and lift your toe up. I don't know if you're trying it inside your shoe. It's hard. It's really difficult. It really works the small muscles of your feet. Yes, bare feet is perfect. Let me play the video again. Yes. Yes. It's the intrinsic muscles of the foot. Now, what happens is it's really important when you walk on sand or you walk on grass to get that small muscles moving, because that's what determines your balance. If you have weakness of this smaller muscles, as you grow older, you are easier to fall, and then you start using or recruiting the longer muscles of the foot or the long tendons to grip yourself and to stay yourself stable. So big toe down, 4 fingers up, 4 fingers down, big toe up. If you can't do it, try it. In next 6 days, you'll get it. Now the next one, as simple as heel raises. We all can do as you're sitting down. Let's have you lift up your heels and down. Let's lift up your heels and down. Now this exercise we do as an ankle mobility. Great if you're sitting on a desk for a long period of time. Just works your muscles and down. And when there's Achilles tendinitis, we load this tendon in a gradual manner just to make sure the pain is better. So that's heel raises. Do you want to do 10, 6, 7, 8, 9, 10? All right. And the last one. If there's an ankle sprain, we are trying to strengthen it. It's a great mobility exercise. Just try to write your name with your feet. Like, isn't that funny? Say, for example, I say East Brunswick. So I do E, A with your feet, S, It encourages our foot to move in all different directions. It helps strengthening. So we covered upon the non-medical ways to get better with pain. Movement matters. We need to fix the cause of the pain along with just the symptoms and the basic exercises that we could do to help ourselves. If we have any questions, Dr. Horowitz and I will be very happy to help. Sure. So the question is, people with flat feet tend to get spasm and contraction as you're trying to do these exercises. So is there any suggestions why is that happening? To answer that question, if there is a cramp or a spasm, we need to figure out why the cramp or the spasm is coming. Is it because of foot weakness? Then we need to start with a lower level of exercise and then gradually build you up. And the cramp or the spasm, we need to find out if there is any systemic cause to that problem, like, for example, electrolyte imbalance or any other muscle tightnesses. But most of the times, starting off lower and then building up on that exercise would help. Dr. Horowitz, you have anything to say on
Yeah, I
this?
was going to say electrolyte imbalances can cause like deficiency in magnesium, any type of imbalances. Sometimes we do a panel, so we check for that basically to make sure that there's nothing actually causing your cramps. Sometimes cramps actually in a leg can be a vascular issue as well. So we check for that. Night cramps, waking you up at night, that could be a vascular component to it. Sometimes we do vascular testing, a series of vascular testing to check, just to make sure that nothing's going on with that as well.
Is it a torn ligament that you're talking about? Is it like an torn tendon, Achilles tendinitis?
So, yes, when do we make the decision to go on to surgery or to continue with the healing process? With like a peroneal tendon, what was it, a rupture or a split tear? Depending on how bad the pain is. We have to understand that the perineal area also has a kind of like a watershed area where the blood supply to the area is limited. That's why sometimes if we break that bone associated over there, which is called your base of the fifth metatarsal, if we break that, it takes a longer time to heal. Tendons in that area also take a longer time to heal than normal. So it depends how much you could tolerate the pain, basically, how bad it is, and everyone is different regarding that, basically.
So the question is, will physical therapy help in building the muscles up and getting the strength up? So to answer that question, every case is very different. I cannot comment on a very broad scenario, but as compared to medical management, what we could say is the idea is how good are you with your functions? Everything we based is on functional analysis. Like, are you able to do your day-to-day activities? How bad is the pain on scale of 10? 0 to 10. 10 is so bad that I cannot walk. Then definitely we need a medical intervention. But if you're able to do your day-to-day stuff, there is some amount of pain, it's not going away, it's good on some days, it's bad on some days. But the fact is, if we can get it good on some days, we have to find cues on what makes it good on a few days, and then we work based on that, and then we can have a proper conclusion. But we can work on ankle strengthening, foot exercises, change the way of walking, correct your footwear, and we can have our answers.
As far as cushioning in the foot, inject, right now, we don't do any of that actually. In the future, well, they're talking now about biologics actually in treatment of foot and ankle pathology. So in the future, we never know basically, but right now, no. Like, like injecting like fat pad and stuff like that. Just outside padding, basically, outside, yeah.
I mean, totally depends on what your main goal is. So the question is, do we recommend any particular kind of brand for a shoe? The answer is no. whatever fits best to your foot. But the idea is if you are a runner or you're a walker, what's the purpose of your shoe? And if you're a runner, you need running shoes, which have they're lighter in weight and they have more mobility over more support. If you are just a walker, you need walking shoes. They are more supportive, a little more heavier, but they support the arches a little more better. So walker versus runner, the width of the shoe, if you have wider feet or flatter arches, you need the wide shoe. If you have collapsed arches, you need the medial longitudinal arch support or the orthotics. If you have the lateral arch which is flattened, or if it's a cavus foot, then you need to make sure you have custom orthotics for definitely cavus foot. Is that correct? Mm-hmm. So depending on what you're using the shoe for and what is the fit of the shoe, and it's highly recommended that after using the shoe for, they say theoretically 6 months, that you need to replace your shoe. Once you see it's wearing out, get another pair of shoe.
Also, you want to be careful like with inserts, because a lot of the inserts that they sell in the store, our weight basically goes with gravity. All the weight goes down to our feet. So if we could take an insert, basically press our hand hard on that, and that arch flattens, that's not helping you, basically. You want something that's really supportive, that's a little bit more rigid in the arch, especially if you're flat-footed, basically. So that's really important. A lot of, they have Dr. Scholl's, you get a 200, a 300, a 400. Those aren't accurate. They really need to have someone come there and do the internal measurements all the time to make sure it's accurate, but they don't. So we have patients a lot of time coming, they said, I got a 250. I'm like, that doesn't mean anything. And I take a look at it and I press down and it's not even supportive, basically. Yeah.
And when you start using an insole in the beginning, it doesn't feel good. Yes. It feels weird because your body's adjusting, accommodating to a newer kind of a surface. So it's not the best feeling ever, but then you get used to it slowly.
Do those have an expiration like the custom ones? You have to replace them every
Well, custom orthotics actually a good pair of custom orthotics can last up to 7, 8 years, basically. So I kind of equate them to being like, we wear eyeglasses for our vision, that's corrective for our vision. Orthotics are corrective for our feet, basically.
Is there a way to tell if you need to actually replace your orthotics? I don't know, any visible signs or
Any visible signs? Well, it depends if you have extra padding and the padding is wearing out, actually. Visible signs to look at the arch, basically, to make sure it's still sturdy, it's holding up. Most of the time, orthotics are made up of a material, it's called polypropylene, which is kind of a semi-rigid device, and they do hold up very well for the most part. The thing that's a little bit less durable is the material that goes over or under it, basically.
Is it okay to wear flip-flops?
No, that's a big no. N-O.
I think even they need to answer before they ask the question. They just wanted it from a source. It doesn't support our arches. You are kind of holding the shoe and lifting the shoe, and you are carrying the shoe rather than shoe carrying you. Yeah. So yes. Anything with a back strap.
And a little bit of an arch support also. Some of them do come with arch supports. But a regular flip-flop, not only is it bad for you, you have a risk of flip-flopping also as well.
So the question is, does cross-fiber massage help in reducing pain? Is that what the question is? Yes. So cross-fiber massage is something developed by Mr. Cyriax in Australia. And what he developed, that technique was only based on releasing. So any kind of tightness or stiffness, what happens is, like the normal muscle fibers are in a straight alignment. With any kind of tightnesses, the fibers go crisscross. So The two-finger massage, it helps in realigning the tissues, increasing blood supply, and breaking the bondages or the not necessary crisscross linkages that we have, and helps healing. So will it help for a particular cause? Will it help with your pain? I don't know, but this is what a cross-frictional massage does. It helps in breaking the, so when you do a calf stretch, when you're stretching it actively, it helps to stretch it. But if there is a lot of crisscross bondages, that's when you need that extra massage to help you relieve the pain and get your more range of motion.
Would there be a way for you to tell if the tendon is like crossing up a lot?
Is there a way to find out if the tendon is crossing up or not? Not visually, but clinically, yes. When you do clinical testing, whoever felt that when they did the knee extension and couldn't bring their ankle up, I'm sure their calves are very tight. And if that is chronic over a period of time, causing aches and pains, there are very likely chances of having those cross linkages in the tendon or in the muscle.
The question is, do you need a different orthotic for each type of shoe?
So they have orthotics for dress and they have orthotics for sneakers. The thing about orthotics for dress, they don't work that well, actually. I normally do not recommend them. People want to put orthotics into a high-heeled shoe. It's not going to work. It won't. I recommend fitting the orthotics into a good pair of sneakers, and I think that really will help. I normally do not recommend orthotics to put in a shoe, but more a sneaker. It fits better, you feel more comfortable, you're not squeezing your foot into a shoe with an orthotic device. They typically don't work. Yeah, because if you have plantar fasciitis, the chances are you probably have posterior tendon pain. Posterior tendon pain is basically Achilles tendinitis. And the Achilles tendon runs into your gastroc muscles in the back of your leg, actually, and it could all be related. It definitely can. You may even have underlying spurs, basically, there as well. That would be seen on an X-ray, yeah. You could see posterior or the back of your heel spurs. You could see plantar or the bottom of your heel spurs. You could see that, yeah. Yeah, I would reserve fusion only for severe pain, basically, because you have to realize once you fuse a joint, there's no taking it back, basically. You're fusing that joint, you're joining two bones together, there's no way of going backwards. And especially if you like walking a lot, depending on what joint they're fusing, like especially, your ankle joint, actually, you won't be able to move that joint. So it's something to think hard about.
So, sir, what we could also check is, does your back hurt? Sometimes it could be the nerves. It could be the vascular area. Like as doctor mentioned, we need to rule out what's going on. Is it just cramps or it's something else too? So if there is any other ongoing thing, because you feel better when you move, it hurts when you lie down. So when you lie down, like, is there a certain position of the low back that's triggering that? So we need to rule out if it's just coming from that area versus anything else. So that should be just at the back of your mind.
Blood pressure medicine doesn't really cause issues with like balance as per se.
I think that's it.
So that's like you're talking about an overlapping like big toe, basically. So the toe like your big toe is going over your second toe. Yeah, that's due to the tendons actually, and the control of the tendons, how they
Oh yeah, that one. Yeah, something like that. Like when the toe crosses over the other toe.
So depending on how bad it's bothering you, I mean, if it's really causing a lot of problems, sometimes there's a derotational procedure, basically, that could be done where it's rotating the toe itself, actually, putting it in the corrected position. But it depends on how much it's bothering you, if it's getting stuck or it's causing a lot of pain, basically. Everyone is different with that respect. And also if you're a person for surgery or not, basically, yeah. Spacers help separate the toes. They do help. That's an easy way out. Spacers, they do help, and they also prevent friction between the toes. So they do help. Sometimes with the spacers, you get sweating in between the toes, so you want to make sure that it's clean and not sweating, because you don't want to get irritation as well.
Are there any suggestions to avoid cramps when you are on a long flight?
Yes. Basically, to avoid cramps on a long flight, and I recommend this to all patients going on long flights, get up, walk. Don't sleep, don't fall asleep for the whole flight. That takes 12, 13 hours. When you get up, it'll be really bad. The number one problem from stagnation and just sitting and lying down and sleeping while you're flying, what we're worried about are blood clots, actually. The incidence is very high if you're just going to sit on a 12-hour trip and not get up, basically. So get up like every 45 minutes to an hour, just walk up and down, basically. I know you're kind of confined on the plane, basically, so it makes it difficult, but it really does help a lot.
So the answer is be the annoying passenger that your neighbor's not gonna like. Excuse me.
Yeah, aisle seat, yeah.
Yeah. She has a great
Sure.
idea. There are two exercises that we already went over it. They are the sitting heel raises. So you sit down and then you lift your heel up and then you lift your toe up. You lift your heel up, you lift your toe up, you lift your heel up. You do this every 20 minutes, a set of 20. 20-20 rule. And the second one, you stretch your leg, you pull your ankle up. You stretch your leg up, you pull your ankle up. What also helps is the compression stockings, must recommended for any flights.
No, they did cover it at one time. Blue Cross Blue Shield covered it, but then they took it away. It's not a covered service, so it's out of pocket. But yes, very high success rate. Yeah. There were issues basically with the way they were billing it and stuff like that, and I wish they did cover it. Yeah. So we do basically one session, and we do a repeat if it's not working, like after 6 months. And most of the time, we don't need to do a repeat. So that's the good part about it. Yeah. Out of pocket for the procedure, it's about 3,000. 3,000. Yeah. 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 It does work. We saved that for the last treatment that we can do, because when all else fails, to avoid going like for what we call an EPF, extensive plantar fasciotomy, basically, it's a lot simpler, actually. Yeah, a lot less risks as well. It helps with torn tendons as well. Yeah, you could take the card. We certainly do that. Yeah, yeah. Sorry, PRP, yes. PRP, where you centrifuging the blood basically, and you're reinserting it back into the heel. That sometimes helps, sometimes, yeah. Does not cover it, no. Anything that helps insurance doesn't cover. Yeah, as well, yeah.
Do you think specific diet, food, vitamins, and supplements would help with chronic foot pain, e.g., magnesium, in addition to exercise and therapy?
You want to answer?
In addition to exercise and therapy, would any diet help? Definitely a healthy diet would help, but they have different kind of diet out there called the anti-inflammatory diet. They recommend coumarin. There are different kinds of like research upon it. It's definitely not my domain, but an anti-inflammatory diet or a healthy diet wouldn't hurt. I don't know if the efficacy, and yes, not something that I would comment on.
I was also going to say diet. If we lose weight and we're overweight, it's always going to help our foot and ankle. So weight loss certainly does help. So a diet where we're watching our diet and we're losing some weight certainly could help with weight loss. With weight loss and
Weight loss and
foot and ankle
yes.
pain, yes, yeah.
We're
Yep.
both in East Brunswick. In fact, we are on the same floor,
We're in the same building.
same level.
On Route 18, you know where the Plaza Hill building is on Route 18? Where Route 18 Lumber is across from Bank of America? Yes, yes, right over there. Yep.
Thank you all for attending, and that's all for tonight. Have a good night.